a show to you. It's called Chatroom with Max.
Unshakable.
Ladies and gentlemen,
Pay attention whenever you're
non-stop.
The primary sign, usually on an adult in a domestic violence situation, are bruises.
God gave him a talent. And the Bible says your gift will make a way for
When we sit there and we blame God for the things that are happening in our lives, no, God never told me to lay down with that man.
Ladies and gentlemen, welcome to Chatroom with Max. It is a wonderful day, a beautiful day, a nice, lovely day. As a matter of fact, an educational day because you're going to be learning a lot. Today, we're going to be talking about a very, very important topic. And we have a special guest in the house today. It's her first time on the show. Very, very knowledgeable. You're going to be learning from her story. You're going to be learning a lot from her experience. And just keep your mind open. Today, we're going to be talking about postpartum depression. So if you're a father out there, get your wife to come watch. If you're a child out there, get your mom to come watch. If you're a mother, just get everybody to come watch because it's gonna really, really impact you. So to do justice with me today, I have the one, the only Sam Soft over there. You guys can see him there.
Hey, how y'all doing? It's good to be here, back again. Always a pleasure to be here and giving you the best education.
Mhm.
Get your pens and your writing materials down to jot down something for yourself today.
Oh yeah. And ladies and gentlemen, we have this wonderful, beautiful lady in the house today. She has, in fact, she is an icon, an epitome of knowledge. We're going to be talking to her. We're going to be asking her lots of questions. So just write your questions down and feel free to type your questions on the comment section. And if you're just joining in, like we always do, don't forget to write your name and tell us where you're watching from, okay? And before we introduce our special guest, let's just do a quick house cleanup. Do not forget to like where you're watching this from. Do not forget to subscribe to this channel. Do not forget to hit the notification tab so you know just when we're on. And lastly, don't forget to share because
share because there's love in sharing. Sharing is caring. Caring is giving. Giving is good.
it's okay. Thank you very much, Sam. Thank you. You always finish the whole thing. I rarely have anything else to say. Okay. So, ladies and gentlemen, with us today is our wonderful guest.
Oh, yes.
She's going to be introducing herself properly, telling you guys what she does, her name and everything. But I will introduce her first of all. Hannah, welcome to the show.
Hannah, you're welcome to
thank
the
you
chat room.
for
Welcome.
coming to the show.
Thank you for having me.
Yes. So, just let the people know who you are, what you do. Yeah, and then we'll dive in.
All right. Well, again, thank you for having me. I'm really excited to be here to
You
talk
are
about,
Welcome.
Something I'm so passionate about. So like Max said, my name is Hannah. I am a mom of 2 girls. I'm a registered nurse. Most of my background has been doing labor and delivery. So helping women become mothers themselves for about 7 years. But now I've taken on a different role, still have that part of nursing in my heart, but I'm working at a nonprofit to help complete some projects that is just going to make maternal health better.
Nice. Wow.
Beautiful.
Yeah.
Beautiful. Thank you very much. Thank you. And thank you for taking the time to come on the show today. We're guys, we're really gonna have fun. We're really gonna have fun.
Can't wait.
Yes. So like we told you right from the onset, today we're gonna be talking about postpartum depression, how postpartum depression almost ruined my life, how postpartum depression almost ruined my life. So we'll be kicking the ball rolling by letting you know that postpartum depression is real. It is very, very real as the sun in the morning to evening, like really, really real. So we're gonna dive in straight right in. Anna, do you want to just let the people know what postpartum depression is to you? And let's begin with that.
Sure. So postpartum depression, to me, I mean, if you're looking at it from a textbook point, it's it is just that. It is depression in the postpartum period. And it's more, people get confused, or not confused, but they can mistake it for just being the baby blues, because people talk about, oh, I get so sad, the baby blues after a baby, it's really normal. It's only normal to an extent. If you're having these feelings of sadness, crying, feeling down, for more than 2 weeks, something else is going on. It's not just those baby blues. It's not that, believe me, after I had both of my kids in that first week or two, I would cry at the drop of a hat for no reason. Someone would look at me the wrong way, I'd burst into tears. Like, it's definitely hormones going on. Yeah. But if there's more than that, if it's going on longer than those 2 weeks, or if there's more severe symptoms than that, there's something else going on. And I think it's important that not just women know this, but men and anyone around them, because the woman herself might not necessarily pick up on it. She might not be able to recognize it because she's already in a different state of mind.
Oh, Anna, can you just welcome to this show, to the chat room? Can you tell us, because you had an experience, an episode in your life.
So I'm soft, you're jumping the
It
gun.
would be good for...
You want to go straight to the story. No, let's layer it. Let's layer it up, man.
Because it is a story that we indicate where we can ask her the questions.
Yeah, but I was actually about to ask. She made a statement that broke things into two parts that we're going to be talking about later. And that's postpartum depression and postpartum blues.
So, but wait, let us hear.
We have two things. We have postpartum depression and postpartum blues. A lot of people don't know that there's postpartum blues and there's postpartum depression.
Okay.
So can you just explain both of them before we go into some soft rush hour?
Okay, go ahead.
Jumping ahead of it here.
Yeah.
So the postpartum blues, the baby blues, a lot of women experience it. It can be upwards of like 80 or 90%. And that can just be, it can be tearfulness. It can be, like I said, kind of crying out of the blue, definitely some mood swings, and think about the sleep deprivation that's coming into play with having a newborn. That's going to exacerbate it a little bit. But with postpartum depression, it's more than just that, oh, someone ate my ice cream, I'm really upset. It's a lot deeper than that. It's an intense feeling of sadness, feeling just the crying, but it's more than just the like, oh, I don't know why I'm crying. It's a much deeper sadness. It's difficult to really put into words. There's an emptiness. You just start really withdrawing into yourself, losing the interest, if you had an interest in something and all of a sudden, you don't find interest in it anymore. I can make a joke that my husband kind of noticed something was wrong when I wasn't finding joy in going to Target anymore.
Oh, yes.
I mean, it's kind of laughable because everyone knows that women love Target.
Oh, yeah.
But in all seriousness,
tell me about it.
It's a dangerous place. But in all honesty, he could tell. He's like, one of the days when he noticed I was really down and was like, why don't you just go to Target, because he knows that's my happy place. And I came back within 30 minutes and he was like, what? I'm like,
that's weird.
Well, yeah. And that kind of was like red flag number one. I know I'm making light of a serious situation, but in all honesty, that was one thing. He was like, well, what's wrong? I'm like, I don't know. I just want to go. I remember I just went and laid in bed after that. So the blues, it's a lot more, I think, intermittent, with just the crying, the tearfulness, the mood swings that usually start getting progressively improved and then should be resolved by that 2-week mark. And then the postpartum depression, it's just a lot more intense. And there's, like I said, the emptiness, almost like kind of becoming numb, withdrawn. So much more you can see the woman almost losing herself in a sense, not being quite herself.
Okay.
I hope that answers the question.
That actually
Long story short.
It did answer my question. Uzovik is in the house. It says, good day, my people.
Welcome,
nice to see
Uzovik.
you all. Thank you very much, Uzovik. So we're going to jump straight into some soft questions.
Yes.
So, ladies out there watching, Hannah is about to share her story about postpartum depression. And I hope you guys pay attention and really learn from this, because this would actually help you. And if it doesn't help you, it will help someone that you know, because some of you will not relate with this, but someone that you know definitely would relate with this or to this. So let's listen to this story.
And then remember to, as you are hearing everything, remember to put down your questions. You can just keep sending the questions while she's talking, so we can be able to ask those questions that will benefit you.
True.
Yeah, absolutely.
All right, Hannah, please go ahead.
So Hannah, the floor is yours.
Oh boy. All right. So please do send any questions. I'm an open book. I'm happy to, answer whatever questions might help educate you or help you feel at ease. So like they said, the reason I'm here, I've experienced postpartum depression. I have 2 daughters, and I experienced it after both of my daughters. The first time I experienced postpartum depression, I should actually backtrack. In that pregnancy, I remember having a discussion with my husband, telling him, I feel like I'm going to be at risk for this because, just my moods prior, my sensitivity to mood swings. I just had I had a gut feeling that something like that could happen. So it took, I was very much in denial the first time. My daughter was incredibly colicky. She would sleep through the night, but she would scream all day. And that led me to literally, I would not leave my house. I would cry with her. Shades were always shut. I just became incredibly isolated, and it took my mom and my sisters calling him saying, we need to do something. I'm worried about Hannah because she is not herself. And, I joked, but I was losing interest in things that had once interested me, whether it was being with family and friends, just taking that solo trip to Target. I was withdrawing. I was isolating myself. I was definitely very tearful, but not, it was a different tearful. There was just a sadness in me that I couldn't explain. So, and my husband, even before my mom and sisters reached out, he had been saying and trying for a couple of weeks to say, like, Hannah, come on, this something's not right. So I was able to, with this first experience with postpartum depression, I was able to get started on medication, on Zoloft, and that takes 4 to 6 weeks to take effect. But by the 6-week mark, I was coming around more. Still not 100% out of the woods, but better. But really, so I was probably really worse off in that bout of depression than I led on to, because I know a lot of my fears inside were, I'm afraid to say what I'm really feeling, because what if people think I'm crazy? What if people want to take my baby away? I don't want to vocalize those fears that I'm feeling about myself, because what if they think I'm a danger to my own daughter? So I kind of silenced that. And I made a promise to myself that once we had another child, that I would not silence those thoughts and those feelings in terms of hiding them from those that are trying to help me. Because if you don't tell the full story, then you're not going to be able to get the help that you need. True. So with my second daughter, she was born June 2020. So right in the midst of the COVID pandemic. Even during the pregnancy, I had heightened anxiety. I was working on the floor as a labor and delivery nurse throughout this whole COVID pandemic. So it was a lot of unknowns. The policies for how to care for a mother and a newborn in this pandemic were changing every day. Wow. And I was getting so scared that what if they separate me from my baby? What if I get quote things like that? So already my anxiety was really high even before having my daughter. But knowing I had postpartum depression after my first daughter, my husband and I discussed with my OBGYN, and we all made a plan that I was going to start on that same medication after I delivered. So I started back on the Zoloft right after delivery, like that next day. The summer was okay. I, kind of maintained a little bit. But once the fall came around, so fall 2020, September, October, it really took a big turn for the worse. I think a lot of that was amplified by the shutdowns, the isolations, the quarantine, because isolation is only going to cause a woman to withdraw more. So again, my husband and I were having conversations, and this time my symptoms were a little bit different. I was just numb. I felt very numb, almost robotic, like I was just going through the motions to get through the day. I also experienced postpartum rage. So I was very quick to go from being okay to all of a sudden just so incredibly angry and yelling. And that's a symptom that is truly a symptom of postpartum depression that people don't talk about. So again, we talked and decided that I needed to reach back out to my doctor. And it was the nurse practitioner that worked closely with my OBGYN who I dealt with a lot. And I can't thank her enough for all that she did. So we decided to increase my dose of Zoloft. And unfortunately, and this isn't everyone's case, so I don't want people to get scared of medication adjustments. But unfortunately, that led to me going even further, deeper into a depression, led to suicidal ideation, to the point where I had a plan of how I wanted to carry it out. I had it calculated in my head of how it would be done. I remember specifically, it was a night in November 2020, that my husband was outside. It was nice enough for my husband to be outside with our toddler. He had her on the swing set. I was inside folding laundry, and our baby was it was kind of that witching hour. So she was, crying, difficult to console. And he came in and she was in the seat crying, and I'm sitting on the couch just sobbing into my hands. And he tried to do everything he could to say, like, what happened? What's going on? And I just said, I don't know. I don't know. And that night we ordered out pizza, and he said, oh, I'll order it for pickup. And I begged him, I said, please do not leave this house, because I don't know what I will do to myself. I don't feel safe right now. And I'm forever grateful to this day that even though 95% of me believed that this earth was better off without me, I'm very glad that there was that small part of me that was able to say, no, don't do that. Please don't leave. So that's when.
Today is one of those days that says it's good for you not to go anywhere, because we need you here.
Exactly.
Chat room,
exactly.
so that somebody else can be saved.
Yes. No, and that's why I share this story, so that women can know it's okay to talk about it, it's okay to tell their story, because that's what's going to get them the help that they need. And that's exactly, I was involved with a social worker, and it was a conversation with her when I was telling her, I feel like I'm a burden to my family. My daughters deserve a better mom than me. Like, why me? Like, they could do better than me. And she said, okay, you need more help than what I can give you. So she referred me. I was referred to the Women and Infants Day Hospital program, which was a partial they call it partial hospitalization. So every day for 2 weeks, it was virtual, but it was an amazing experience because it was not only group therapy, there was individual therapy. So social workers, psychiatrists, everyone that really knows all about this topic.
And you hear other people sharing their stories too.
Exactly. So not only that, while I was working with the social worker, the nurse practitioner I had mentioned earlier, she contacted MCPAP for Moms, which is an access line essentially for OBGYNs to be able to, if they have someone that's experiencing symptoms that they don't know what medication, they can contact this line, and someone that a perinatal psychiatrist can give them recommendations right then and there. So with that, and then really what was the final savior was I was fortunate enough to receive the IV infusion of brexanolone or Zulresso. So I made the decision I had the option to bring my youngest with me, but made the decision it was probably better to leave her at home with my husband. So he had both the kids, and I was admitted to the hospital for 60 hours for this infusion. And it was around hour 24 that I remember feeling like that tight noose, like felt like I was in a straitjacket leading up to that. And I finally felt that getting loosened. And when my husband picked me up from the hospital, when I was discharged and I got in the car, he said, "Oh my God, it's you."
Wow.
It's you.
Wow.
So it was an experience that I don't wish on even my worst enemy, because no one deserves to feel those types of feelings. And that's why I like to tell my story in hopes that if there is a woman that is in that situation, that she can see that it can get better, and that even if there is part of her brain telling her that, the world is better off without her, that is not true.
Wow. Thank you very much.
Thank you so much, Anna.
Question. So, guys, if you have questions, please type your questions in the comment section. I see some questions coming in already, but we're going to keep the conversation going. Scrolling down, you see Hannah's TikTok handle and Instagram handle. Please do well to follow Hannah, okay? And please don't forget to type your questions, okay? So, my question for you is, what were those major symptoms, or how did it, what were those beginning symptoms, that moment where you felt like, hey, something is not right, and how did it transition to become heightened? And second question, do you think you were genetically predisposed to this, or do you think you were genetically predisposed to postpartum depression?
All right. So the first initial symptoms it was definitely just a lot of, I think, feeling very overwhelmed. Babies don't come with manuals, and it doesn't matter. It doesn't matter how many babies you have, whether it's your first baby or, your third, fourth, fifth, whatever number baby. No baby comes home with a manual, and every baby is different. So it's overwhelming, whatever transition it is, going from 0 to 1 children. So I was overwhelmed. And I felt my energy levels. At first I played it off as, oh, it's just, I'm getting up in the middle of the night with a baby. Of course I'm going to be tired, but it was more than that. Like, even getting off of the couch was a chore. So it was almost just like a constant state of being very, very drained. And it's once I started almost feeling anger when I would hear my baby crying. I would feel anger and almost like resentment, just like, why are you crying now? Am I not doing enough for you? Like, I'm giving you everything I can. Once I started, I'm like, this isn't right. I shouldn't be angry that my baby is crying. This is their way of communicating with me and telling me something. Why am I getting angry? So once other emotions started coming into it, then that's when I'm like, okay, something else is going on here. And then in terms of being genetically predisposed, I don't know necessarily. Is there a chance? Absolutely, because genetics do play.
Correct. Yes.
They do play a role in the likelihood of someone developing it.
Yeah.
In my family, there is a history of anxiety, depression, going down the, if you're looking at the family tree. So I would say likely yes. And I likely had even anxiety, depression prior to pregnancy. So that is also another check mark in the box to say that I was predisposed.
Well, thank you very much. Thank you also for sharing your story. We do appreciate it. We believe that a lot of people are learning from this story. Please do well to type your questions in the comment section, and even after this live show, still type your questions and we'll forward them to Hannah and she'll get to answer you. Emeka asks us, he asked the question, and his question is, do men indirectly experience postpartum depression?
So they can certainly indirectly experience postpartum depression. They can even directly. 1 in 10 men experience postpartum depression, and that's something that is not talked about near enough.
True.
So, I asked my husband before I came here to do the podcast, how did you feel when we were going through that? Because it wasn't just me going through it, it was my husband too. And he said he was nervous, and he felt helpless because seeing his wife just suffer no matter what he did. He felt helpless. And so definitely men indirectly, if their wife or significant other is experiencing postpartum depression, it can certainly lead them to develop it as well.
True. Rachel asks a question. She says, thank you for sharing your story, Hannah. Very difficult to share, but you have conquered the fear of being judged and was able to get the help you deserve.
Thank you.
Yes, very true. Very true. So I want to hit on the point of the SI. During that moment, how tough was it, or how easy was it for you to share that thought with your husband?
Not easy at all. Because I already knew how I knew he was trying to do absolutely everything he could to help me, and to tell him that, despite, all of the help that he's trying to give me, that I'm still having this thought of wanting to end my life, was really hard. So that really was the night, like, we hit, when I finally vocalized that is when I think we hit rock bottom and we're finally able to start going up. Because that made both of us realize, once I actually said it out loud, that I need a heck of a lot more than whatever we're trying to do right now.
True. And I'm just the medication piece out there. I just wanted to say something about the medications, right? There are some medications that when you begin to take, it helps your symptoms, and it gets to a point where you begin to experience some side effects of those medications. There's some medications that the side effect is actually suicidal ideations. That's why it's very, very important for you to be open in discussing with your significant other, family members, people around you, your doctor or your psychiatrist or your nurse practitioner, so they're able to know just when to either taper you off that med and transition to something better or something else. Because at the end of the day, everybody is trying to put hands together to help. So Rachel has a question.
Sure.
She says, do you experience this during pregnancy? Prenatal depression. How was your pregnancy journey for both kids? Do you think it's sometimes triggered by how the pregnancy process goes?
Very good questions. So I did experience depression during my during parts of my second pregnancy with my, well, obviously second child. We had so much going on. Not only, we had planned for the timeline of things, and it was going as planned. We had I tested positive, like I got a positive pregnancy test probably about 3 or 4 days before we were due to move. So we had a big move looming. I had awful morning sickness with both of my girls. And so just to have to wrangle a toddler while I just wanted to lay in bed because the smell, I'll never forget the kitchen of that house that we lived in, the cabinets, the smell that they had, I could not.
Did the test, like when you saw the positive text, does it trigger something?
So I was very excited. We were hoping, like we were trying, but I was definitely in that moment, like, okay, we're signing up to possibly go through that again.
Okay.
So that definitely was a thought in the back of my mind and in the back of my husband's, which is why, because of my experiences,
first one,
because of both of my experiences and the fact the second one was so difficult, that we've decided we're happy with our family of 4. We don't want to. We're comfortable with our decision to say we're done. We're done. But I definitely, because there was just so much stress between the move, having a toddler, there was definitely a lot of just high tension between my husband and I. We were arguing more. I was very emotional. So I did start talking. I didn't start on medications. I did start talking to a social worker in the middle of my pregnancy, but then COVID happened. So then it just kind of went to the wayside, and I feel like my depression that I felt I was experiencing, that all of that energy got heightened, but more into an anxiety state, focusing more on the COVID pandemic. Like we agreed that I wouldn't. The only places the only place I went was to work and home.
Wow. Yeah. Because of COVID.
Yep. So, what were other parts of the question?
The other part of the question was, do you think it's sometimes triggered by how the pregnancy process goes?
Absolutely. Absolutely. If it's a difficult pregnancy, whether it's because of something that's going on with the baby, or it's symptoms that the mother herself is experiencing, like whether it's the morning sickness or hyperemesis, or that can certainly lead to depression, whether it's during the pregnancy or postpartum.
Wow, thank you. Yeah. Eugene is in the house. It says, hi, chat room crew watching from Nigeria.
Welcome.
Thank you very much, sir. Samsov, do you have any question right now?
My question would be, what are the things that could trigger this kind of depression? And my second question was before starting a family, making of children, could spending times with your siblings' children and friends' children help in terms of getting familiar with children and handling of children? Could that help?
I think that second question, if you get the logic behind that second question, it's trying to say, could getting trained with kids help with
the experience? Because sometimes I'm thinking maybe because the person is just new to this life, because it's a brand new life. Having your own child is a different world. So it's different from you just seeing them from afar. They are beautiful, just like you owning a dog. Like you have a dog, somebody can just like say, "Oh, I love dogs," but by the time you own a dog, just taking them out for a walk is a lot of work. Then you realize that, oh man, just having a dog is not fun, but from afar, it's fun. So that's the reason why I thought about like having children too. They are beautiful. Oh, look at those people from somebody else, but now it's coming from you. sometimes now when it comes from you, those other things that comes with it, the crying, the process of the child from the beginning to the end, overwhelm the person. So that's why I was asking that question.
So let me just steal.
It's for her.
Yeah, that's why I want to steal the second question.
Okay.
And give a little background before she answers her own part. Right. So postpartum depression is not just because of, it just doesn't come from the stress of raising children or from the fact that you are overburdened with things. It's due to some hormonal imbalances in the brain. There are some women that have had children and they were fine, and this kid came and they went through postpartum depression. That doesn't mean that they were not able to they were taking care of all the kids fine. There are some children there are some women that right there in the hospital after childbirth, it hits. I've seen a patient where she just gave birth and she wouldn't even want to look at the child. She would turn away and was just crying. It's not as if the child was crying or anything or giving her troubles, but it's because of the imbalance.
So meaning that it's a medical disease. It's not actually triggered by anything.
The word disease, no, but it's a condition that comes with chemical imbalances sometimes.
Because you're making it, when you go to the medical aspect,
triggers. It has triggers.
Okay.
Just like anything can trigger anxiety, anything can trigger depression, PTSD, all those things. It has triggers. But for something to be able to trigger something, it means something was there,
inside
something
there
was happening already for it to be triggered.
So it's medical.
Yeah.
Okay. So
it's people use medical for everything, but it's psychology. It's psych.
Okay. Yep. Okay.
Yeah, so please. Yeah. Sorry for stealing. Sorry for stealing that question.
That was the perfect explanation.
Yeah. So
So remind me of first question.
What are the things that could trigger this kind of depression? Because that's why I brought the two together.
Okay.
Because like the other one is if spending time with the children before you have your own, would that help to prevent that kind of depression? So because I'm asking this question because I know that so many people that is watching too, so that everyone can be educated and prepare themselves.
Sure.
Anything that can help to prevent. Absolutely. Because like you remember you said the second one, you were thinking of what to do so that what happened in the past, you'll be able to handle it even though if it happens.
Right. Yeah. So, I mean, the biggest trigger for it is, like you said, the hormonal imbalances. And there's still, I think, a lot of studies that need to be done to really determine what the true cause is. And for some women, the cause might be different. I know that one of the studies I've been most interested in talks about a progesterone metabolite, allopregnanolone, how it increases and increases and increases during the pregnancy. And I talk about this actually in one of my TikTok videos. So that continuously increases during the pregnancy. And then once the mother delivers the child, that plummets. And the GABA receptors in the brain can't really, it's almost like they're short circuiting because that drop of that progesterone metabolite, now the receptors in the brain are like, well, what the heck is going on? And they're hypothesizing that, or they might have actually proven based on medications they've made that can be a trigger.
Okay.
But definitely, I don't know if necessarily being around, because I was around, I have nieces and nephews. I was a labor and delivery nurse. So even before having my own kids. So I think did it certainly help prepare me for what motherhood looked like? Sure. But it's just like, I know grandparents.
But that's different though. Just like I explained with seeing somebody's dog, you can just play because it's not your responsibility to care for that dog. But you can play with it, have fun with it. But then when it's your own, it's different.
Oh, absolutely.
You walk the dog. He's going to poop on your chair, on your couch. You're going to say, "Oh my God, I didn't know this comes with it."
Yeah.
So that's why I asked that question.
My
Sure.
question for you is, for someone who is experiencing depression prior to getting ready to conceive, should there be a special plan with their team?
So I think that it's really important for, women to vocalize that and talk about that with their medical team. If they're established with an OBGYN even prior to pregnancy, like let them know that. But it doesn't only fall on the women to necessarily, divulge that. It also should be something that doctors' offices are screening. The screening rates for postpartum depression or even perinatal depression are not where they're supposed to be. It should be at 100%, and it is nowhere close.
Why? Could it be that people lie during screenings because of stigma?
Well, certainly there's that fear of stigma, and how are they going to, just like I said, when I was nervous about vocalizing how I felt the first time, because I'm thinking, oh, they're going to lock me up in a loony bin. They're going to take my kids away. So I think there's definitely a stigma.
Wow.
But also postpartum depression, perinatal mood and anxiety disorders are a topic that not a lot of people, even providers, are comfortable talking about because there's such a huge lack of resources. So even if someone were to screen positive, well, okay, what do I do with this?
True.
So it's, there's a lot that needs to be done. I will say it till the day I die that I know how fortunate I am that I have the outcome that I did, because I know not all women do. But we need to get more resources out there for women so that.
Can you tell them that they will not be locked up and they will not take the children away from them?
I am perfect. A perfect example right here. I told them my thoughts, as scary as they were, and they did not judge me. They did not say, "We're going to take your children away."
Thank you.
They said, "Let us help you."
Mm-hmm.
The biggest thing I think women fear is being judged. That's what any human fears, is being judged.
Correct.
And being your true authentic self, even if it's not being at the best version of yourself, is really important.
So I want to delve straight into the partner side of it.
Okay.
Yeah.
Because while you were going through what you were going through, your husband was on the other side, trying his best to help you.
Yep.
How did you feel, or what was the feeling like, knowing that he was doing his best, but it wasn't enough? And what were those things that he did that you felt that really actually did help? Because I want men out there to
know how to handle it.
Oh, absolutely.
Yes.
So first off, guys, just letting your wife, significant other, know that you're there for them is first and foremost the most important.
Are you hearing, men? Make sure you let them know that you are there for them.
But don't just say it. You need to prove it.
Prove it.
But that's exactly what he did. He was willing to pick up more of the slack around the house. He was willing to say, like, let me take the kids, you go. Like, my biggest thing was I need sleep. So he would say, let me take the kids, you go take a nap. He would be doing more around the house, whether it's laundry, dishes. Like, he literally just lifted everything up while I was just trying to stay afloat. And I was so appreciative. And at the same time, I also felt so guilty seeing all the work that he was doing to try to help me and that I wasn't getting better. I felt so guilty and thinking, is there more that I need to do? Like, what is wrong that, like, he's taking all of this off of my plate to help me and I'm still like this. So I was so appreciative of it. And at the same token, because of my mindset already, the guilt was immense.
Wow. But while you were talking, I just I just had this thing in my head. Maybe before the end of this year, one of these days, chat room would collaborate with you, where we're gonna have like a day with where we're gonna have a day with like lots of women who have been through postpartum depression and their partners, where we just sit down, maybe like a dinner kind of setting, where we sit down and just
that's a good one. That's a good idea.
And share our stories.
That's a beautiful idea.
Yeah, so definitely, I would definitely I'll hit you up.
Yeah, I love that idea.
To talk about that. We have a comment from Eugene. He says, when this depression sets in, can it be countered or suppressed with drug use? That's medication use. Nigerians call medication drugs.
Okay. Okay.
So it's not the other one.
It's not the drug.
I was going to say could certainly mask it. But...
I always tell them it's medication.
It's medication. That's drug.
Okay, drug is different.
They always tell me, "Oh, I'm going to take my drugs." I was like, "Oh, okay."
Secondly, is this condition heritable? So is it heritable? Is it inherited?
Mm-hmm.
If in the affirmative, what is the percentage of heritability?
All right. So it can be, I guess my way of taking that question, can it be countered? Like, can it be treated?
Yeah, treated with medication. Yeah.
It certainly can be treated with medication. And the thing with medication is that everyone is going to react differently. It might be a different dose. It might be a different medication, but it certainly is treatable with medication.
Yep.
Sometimes just medication works. Sometimes a person needs medication and therapy. It's unique to the person. And then it can be inherited. There can be a genetic predisposition. I'll be honest, I'm not sure the percentage, but it is definitely a risk factor that if a healthcare provider is, assessing their patient, their female patient, and they say, my mom had postpartum depression or my sister did, that already should be marked as, okay, this woman that's sitting in front of me is going to be at increased risk.
Okay.
So, like, what I wanted to add was, try not to lie during assessments, because when you lie during assessments, then it's more difficult. Like I tell my patients, if you're not forthcoming with me, it's difficult for me to help you, because I will have to keep trying to dig and dig and dig when you could have as well just
because if you are lying, the person will misdiagnose you. Because it's not giving you
even diagnose
exactly.
Right.
That's misdiagnosed too.
No,
because you are not diagnosed.
If I don't diagnose you, doesn't mean I'm misdiagnosing you. Misdiagnosing you means I'm giving you a diagnosis that is not true or that is not accurate. It's better I don't diagnose you at all, because it's not confirmed yet from the stories I'm getting.
So you cannot be you don't know exactly
instead of me
what is
telling
going
you,
on.
Sam Soft, you have anxiety.
And
then you don't actually have anxiety. You just faked all those symptoms. So yeah, I'm so
no.
Oh yeah.
So please be open. It's really helpful. Like she said, if during those assessments, one says, "Oh yeah, I have a history of this in my family." Or let's use depression for example. "Oh, I have a history of depression in my family. Oh, my great grandmother or my mother had depression." Then what that tells us now as professionals is, okay, in taking care of you, we have to factor in this fact that this could be a possibility, not that it is happening. It could be a possibility. So we now channel and word our questions right centered towards you in relation to that particular diagnosis from the past. So it's all a team effort trying to help. Rachel says, being an L&D nurse, do you think that having an undesired C-section versus verge delivery triggers this? Is there a correlation between CS and PPD?
So absolutely, I think there is. It can increase your chances of postpartum depression, or it might be more along the lines of PTSD if you have an undesired C-section versus a vaginal delivery. Can certainly trigger it, and it can be for a number of reasons. when a woman becomes pregnant, I don't want to say all, but most women don't imagine a C-section being their method of delivery. They imagine a vaginal delivery. So right off the bat, if there's an undesired C-section, they're going to mourn what they had been envisioning for their, their whole pregnancy. And then, what was the why of the undesired C-section? Depending on that, can cause a lot of trauma. And I know that there's a lot of work going on for healthcare providers to be more trauma informed and be providing trauma informed care, especially in labor and delivery, because of the aftermath that it can have. So I don't want to say that there's for sure a correlation between a C-section and postpartum depression, but I do think that it is possible that there's that correlation, especially if the C-section was unplanned, or if it was undesired, and the woman was really kind of, I'll say, attached to that vision of the vaginal delivery, and that wasn't what happened. So I don't want to say for sure there's a correlation, but I think there is a very good possibility, yes.
So yeah, just like I loved what you said and how exactly you said it, because that there's something we humans, right? When we envision something, we plan out something, and it doesn't work the exact way we intended it to work, then something happens to us mentally. Something happens. So how do you handle a situation like that where it was an undesired C-section and it has brought about some level of depression or postpartum depression? How do you think a person would be able to get back up and take care of themselves?
So I think it's really important that they talk to somebody, and something that I'm trying to actually work on, kind of instilling with practice, is that if an unplanned C-section occurs, that people will talk about, nursing teams, doctors will have like debriefs after situations that are unexpected. But we need to start including patients in those, because not only did we not expect the situation, but neither did patients. So there's going to be a big push to include the patients in those debriefs, to not only help them, because there could be the fact that they don't quite understand what happened, depending on if there was a lack of communication between the patient and the care team. So, I think that talking to someone will be the biggest thing in helping a woman kind of process what happened, accept what happened, and, not necessarily move on, like get over it, but take the steps towards that acceptance and moving on from that.
So like you rightly said, we're not just looking at, in situations like that, we're not just looking at postpartum depression alone. We're also going to be looking at things like PTSD, because it could be very traumatizing in the sense that, you never saw this coming, and all of a sudden, boom, it just happened, cut, and all those things. Just those actions alone could actually cause some serious trauma, and I agree with patients being involved in the debriefing process. It's going to help them understand why this had to happen, and show that yes, we do care for you as a team,
right?
Rather than this happened, bye, you're discharged, you can go home.
Exactly. Yep.
Wow. Ladies and gentlemen, thank you very much for still being here.
Thank you.
I hope you guys are understanding the terminologies.
We didn't use a lot of medical jargons.
And those of you that are watching from Africa, because most of them don't understand.
I was actually that was where I was actually headed
most
next,
of those things,
because we have a lot of viewers from back home, right?
Oh, very nice.
So back home, depression, anxiety, postpartum depression is really not.
It's very spiritual. I'm in their terms. and breaking it on their terms.
Some people spiritualize it.
Yep.
Okay.
Not some people, most of them, majority.
I don't have data to show.
Because it's all, as a matter of fact, because majority of them don't know if they are depressed or because if they feel they are going through a problem, a spirit is actually causing it.
Okay.
So it's something from maybe the village or somebody that look at them strangely, and then they feel that way. They say, "Oh, somebody have done something to them."
Okay.
Oh yeah.
Okay.
So they in their mind, so they spiritualize it.
Gotcha.
Yeah.
Okay.
So I'm being real. I'm trying to be real.
I mean, it is true. It's different amongst all cultures and backgrounds.
Exactly.
Yes, that's accurate. You know, but my thing now is this: it's in the area of what's this word again? I used it earlier on. Stigmatization.
Mm-hmm.
Yeah,
stigmatization. You know, a lot of people, even CS. You know, they don't see CS as normal. You know, some people will say, "Oh, you're lazy. You couldn't do this on your own, so you needed to do CS to get that done and all that."
Yeah,
and that even heightens the depression,
Absolutely.
which leads more into postpartum, or could trigger postpartum depression. But in this scenario right now, what advice would you give to that lady out there, or that woman out there, who is silently going through postpartum depression and doesn't want to accept his postpartum depression, doesn't want to believe it's postpartum depression, or doesn't know what to do about it? What advice would you give?
So, I mean, first off, I would say you need to use your voice. If you don't think it's postpartum depression, but something doesn't feel right, if you're feeling that overwhelming sadness that just you cannot get over, you need to use your voice to say something. It might not necessarily have to be your doctor, even though that would be my recommendation.
Mm-hmm.
If it's your significant other, you're a family member, a friend, talk to somebody. Let them know, because no one can be there for you to support you if they don't know that you need it. People, I need people to tell me. I always vocalize to any of my friends before they have children, because they know how much this topic means to me. Talk to me, because no one can help you if you don't talk. It's nothing to be ashamed of.
Yeah.
If anything, it's going to make you a warrior. Once you say that I've overcome it, it's going to make you stronger. It's going to make you it's going to be part of who you are. I'm proud to say that is part of me.
Yeah.
That has made me who I am today. Those struggles, those dark times have catapulted me into a new direction in life. So it could do the very same for you. So it's a hard time, a hard thing to go through, but just lean on those around you, your medical team, your friends and family. Vocalize it's okay. And just know that it's not forever. It's not forever.
So those ones that are going to be like what she's trying to say to you, I know that some people will be saying in their mind that, who am I going to speak to? Who am I going to talk to? Everybody around me, they're going to stigmatize me. They're going to
talk about me to everybody,
especially the from the part of the country we're talking about. People will always like to stigmatize you, or they'll be so. As a result of that, they shy away from speaking out. But you should know that everybody is not the same. There's somebody that that you can speak to. You have to find them. You know your friends. You should know the people that you can share with, or go to a professional. I think in that kind of state, you go to a professional, because most of the time, they will try to silence you, because they say, don't say it, because if you say it, you're going to make us look bad. Not in our family.
Not even just that, they will say, pray, so God will take it away.
Yeah, that one too. They said, pray, let us pray about it and it will go away. And then also they will also say, we don't want you to say that because it's like an abomination in where we grow from, you come from. Okay. So I'm saying to them now that you have to figure out a way which is go look for a professional because you need help. It is all about you. So the only way for you to do that is follow that advice that she's giving you. Talk to somebody, but now look for the best person to talk to.
So like Hannah said during, I think that was the beginning part of the video, she said during COVID, it kept her inside, and that kind of facilitated the whole, postpartum depression, heightened it. That's what the symptom is. It makes you not want to talk. It makes you not want to go out. It makes you just want to stay inside and be alone. You are amongst people, but not with people.
Mm-hmm.
It makes you just and so on and so forth. So the best thing, what I think is, try your best to fight against all that it's making you.
Yes.
If it's making you not want to talk to people, get that person that you feel comfortable with and talk to that person, talk with that person. Even if you don't want a solution, just talk.
Yes.
Express how you feel and let the person just hear you. If it makes you not want to go out, try to just push yourself, go out. The sun does something to us that
it does.
Yeah.
Yes.
It does. When you stay inside, just like you feel blue, that I feel blue. So when I'm inside, I just don't want to go, I just feel down. I feel, because when the sun just hits you, there is that relief you just get.
Yeah.
Get some vitamin D.
Okay. No comment. Hannah is here. Hannah is here. I can't do what I always do on the show to this my brother. But yeah, just get yourself out there. Try interact with people. And again, just your ADLs, activities of daily living, things that you do. You might feel you don't have enough energy to do things because obviously that's one of the symptoms. But try to just do things. I've had a patient that told me that I felt worse because my room was just in shambles, things everywhere. I couldn't do anything. So the more messy the room got, the more symptoms grew. So it's like, then in that case, get people to come clean your house. Get help.
There's something I got from what you just said too. Do you know that there are some people, you ask them, maybe you are meeting them for the first time, and you ask them, what do you like to do? What are the things you do for leisure? Some don't know. So that could be a sign of there's something going on.
That is called anhedonia. Anhedonia, lack of pleasure. You don't have pleasure in doing things, so you just don't do anything. So that's part of a symptom of depression, of course, postpartum depression. So depression, symptom of that too. Same thing. So, and some other people will tell, I used to enjoy doing this.
Right. That's a key statement right there.
Oh,
exactly. So for you, that is a friend that is not a professional in this, when you hear a friend telling you things like this, what do you do about it? So when a friend, let's say he's my friend and I'm going through postpartum depression and I know he's not in that field.
Yes.
And I come to him and I tell him some stuff, I used to enjoy doing this, but now I just don't have pleasure in doing anything anymore. I just want to be inside. I don't want to go out, blah, 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 blah. What would you advise him to do or say to me?
Yes. Please.
I would advise him to say, ask the direct questions. are you okay? I feel like something's going on. And someone going through postpartum depression or depression might not be able to really answer that. And then in that, just let them know, I'm here. Let them know that you're noticing that something seems off. Not, you don't need to be nasty about it, of course, but that, I know for me, that was what led me to get the help that I got, was my family saying, Hannah, something's not right. So letting that, your friend know that, you used to love doing that. Now you don't. Something's going on here.
Correct.
Something's going on. Identify that for them when they might not be able to identify it for themselves.
Okay.
Thank you. Dr. Tolu, you're welcome.
Welcome, Dr. Tolu.
That's Dr. Tolu, our wonderful sister. Yes, welcome to the show. Can you hear us? We can't hear you.
Oh, can you hear me now?
Yes,
yeah, we can hear you
now.
Awesome. Hi, everyone. Hi, Anna. So nice to meet you.
Nice to meet you.
Yeah.
You're welcome.
So we've been doing justice to postpartum depression. And I was asking some questions. My next question now is, do you think that, how do you think that as a community, we should, as a community, let me rephrase it this way. How do you think a community or family or spouse can help that member of their family who is going through postpartum depression?
So they can help in a multitude of ways. First off, just by being there to listen if the person wants to talk, by trying to pick up some of the slack, like what my husband did with trying to take some of the, chores, the household chores off of my plate and take some of those responsibilities, because that will hopefully give the person that's going through it more time to hopefully work on themselves.
Yeah.
And not alone necessarily, but it will give them the time. I'm big on talking about like self-care, because self-care is you're giving love to yourself.
Yep.
So even if it's a matter of, you don't know, like, because for me, when I was going through it, I'm like, well, I don't know what I like to do anymore. So it was a matter of being able to get a quiet shower without kids, little things. And so just giving the opportunity for that, but not being afraid to try to give resources for help if, you think that just the listening and just the helping isn't enough.
Okay. So, Dr. Tolu, welcome. I'm going to ask you two questions in one go, so you handle them. Postpartum depression. What's your take on postpartum depression? How do you think people who are going through postpartum depression can, what do you think they can do to get better? And lastly, how do you think the people around them can help?
Fantastic. Okay. Now that we're on the last one, what was the first question?
Postpartum depression. What's your take on postpartum depression?
Okay. All right. So it's a mood disorder, as you know, that affects women after childbirth, anywhere from immediately after childbirth, like up to a year after childbirth. The operative phrase being after childbirth, postpartum, after, giving birth. The second one was, how do I think people ought to handle it?
Yes. What do you think they can do to get help or get better?
Well, first of all, we have to at least agree that it's a real thing, that she's not making it up. Particularly for our culture where the woman is expected to be strong, to be ready to just go. Okay, so you just give birth, wonderful, get to showering the babies, get to mopping the floor, get to go, grocery shopping and all those things. To agree that it's a real thing that requires attention, because it does, because harm can come from it, great and tragic harm if it's not addressed properly. And then you said, how can people around them help them? Again, admit that this is a thing that requires attention and not shame them for it.
Thank you.
Really, our culture, we're like, Women have been giving birth for millennia. What's your problem?
Mhm.
You know, get up and go with it. No, no. I'm not sure if you guys had. I'm not sure if I shared this with you before. One of my very dearest friend. You know, she's a nurse, many years, very resourceful woman. She gave birth and entered what she later realized to be postpartum depression. She wanted nothing to do with her beautiful baby. She was crying all the time. Thankfully, she's married to a man who has a lot of empathy. So he quickly realized, no, this person is a strong person, but there's something is not right with the situation. You know, and he really was a support. I know for a lot of women that may not be their experience, you know, because people are like, what? So you had a baby, get on with it, you know. But at least, first of all, identify that there's a serious, particularly when we get to the points of thoughts of self-harm or thoughts of harming the baby. You know, something we call anhedonia in medicine, when they've lost all desire for anything pleasurable at all. Those are like huge red flags. This person needs help and they need help ASAP, you know, and to seek for professional help. I like what Hannah said about self-care. Ladies, 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 y'all do so much. Y'all take care of everybody else except yourself. Please get you some rest. Get you, like she said, a shower without the babies. Ooh, that just sounded like heaven.
Right? It's a dream. Even the grocery store without a baby.
I'm telling you, like nobody's calling your name. Nobody wants anything from you. Just a few moments of quiet to actually be able to digest your own food without little or big hands wanting to be a part of it. You know, so
big hands.
It's really
little or big hands.
Say that again.
You said little or big hands?
Little or big hands. Yes.
Can you please elaborate on the big hands?
Break it down.
I have a feeling you know exactly what I'm talking about. It's just the thoughts that I have.
Oh, fine.
Stop it.
Okay.
Okay, let's take this question real quick. Ray says, how did it affect your spouse and those around you? If you don't mind sharing, did they share that with you at some point, or you just figured it out?
So when I was really in the midst of it, I wasn't quite sure how it was affecting my husband or my family. But after the fact, I asked him, I'm like, how? And even today, before I came on the show, I said, how did you feel throughout all of this? Because you were the other half of the equation. And it definitely affected him. The amount of stress, he felt helpless. And I think that definitely brought him down a bit. My family, I was able to mask my symptoms the second time around because of that COVID isolation. I wasn't around them. You weren't seeing people, you know, face to face much. So it was a lot easier to hide. So they didn't pick up on it quite as quickly the second time around because I was able to hide it. And it wasn't until my mother, I didn't vocalize much to her until I was the following week going to be getting admitted to the hospital for treatment when I finally told her.
Masking your symptoms.
Yeah.
What were the differences between the first time when you did not mask your symptoms? Mask, for everyone that doesn't get it, is hide our symptoms.
Covering.
Yeah, covering it. What were the differences between the first time when you did not mask your symptoms versus the second time when you were able to mask your symptoms? That's the first question. Second question, how easy was it for you to now mask your symptoms, and why?
So the first time, I think a lot of it had to do, I feel like I'm bringing COVID up a lot, but I think that had so much to do with it. When I had my first daughter, it was 2018. So, you know, COVID wasn't a thing yet. We were still all getting together. There were still visitors coming. So people were able to physically see me, see me interact with my child, and just see that something wasn't right. Whereas the second time around, it was COVID. So it was, if anything, you're seeing people over a screen, or just talking to them on the phone.
Somebody's having a mask on.
Well, literally, like it's so much easier to hide.
Yeah.
People might not pick up on those subtle things when you're not in person with them. So, when I went to work, because I was still working at this point, I was able to, I think, compartmentalize and put on that nurse mode, and shut out the other part of me and just kind of turn on nurse mode and just be that. But so I think that a lot of it just had to do with the lack of socialization and face-to-face. As much as my husband, he was the biggest one to be able to say, like, this still just doesn't feel right. I still don't feel like you're where things are where they should be. And I feel like we need more help.
So you can say, would you say that you suffered more the second time during COVID than the first time when you had help?
Absolutely. Absolutely.
Doctor, you have anything to add?
Oh, I'm just, the whole thing just touches me because it's amazing the things we women can carry and feel shame about. Motherhood, particularly first time motherhood, should be exciting. It should be wonderful. But when you feel overwhelmed by stuff that you don't even know is overwhelming you, and then you also feel people looking at you like, is she being a good mother? Is she carrying that baby just right? Does she have the bright, happy smile face? Does she look, like a mother? It's amazing the things that just other people's thoughts, what we perceive to be their thoughts about us, can be bothersome. And then instead of you feeling accepted, like, oh yeah, she's now a mother, you feel as though, are they judging me? Am I doing this right?
Absolutely.
It's an interesting thing. When our son was born, when we came home, I remember, believe it or not, when they were going to discharge us, I thought, they're going to make me take him home. My husband and I are going to be by ourselves with a new baby. I'm like, we're going to be by ourselves with okay.
It's like, do we have to take a test or something? Do we have to pass the exam? Like,
are we ready for this? Amazing things, and in ancient cultures, back in our community, the reason why a lot of times that was not seen was because the new mother had so much help. Especially a younger person who was around, like the major domo, who could be sent to do any and everything. There was an older woman who, either her mother or her mother-in-law, who was there to help her with the new baby. So that some of these things may be missed because she had help. She had warm bodies to help her do stuff. But in our modern life, it's just you. Most times, it's just you and your spouse, you and whomever it is you've had this baby with. And I think that also contributes to just incredible pressure on a new mother. The fact that we don't get as much emotional and physical support as we used to.
Doctor, from what I'm hearing from the sideline.
Oh dear.
I like to.
Yeah, because I mentioned that before earlier on. So go ahead.
What you mentioned, I don't communicate in spirit.
Go ahead. Finish.
What I'm hearing from the sideline, the economic situation of our world today has a big part in has a big part in the heightened level of postpartum depression, anxiety, pretty much mental illness in general.
I wouldn't call it a causal relationship, but
I'll take it. I'll
relationship.
I'll correlate it this way. back in those days, where we're from, right? You would have family members around to help out after the child has been born and all those good stuff. Now, the mother, even though might be experiencing postpartum depression, had ways of masking it, or because they don't know, they downplayed it. And because there were a lot of support, she could sleep, she could rest and do other things that made her feel better at some point. But now, with the level of things, the way the world is going these days, where everybody has to work, everybody has to make money, nobody is barely home, you know. And even during COVID, actually, that was what made me become a psychiatric mental health nurse practitioner, because COVID hit and I was like, no, this is gonna get bad, because that physical communication with each other as a world stopped. You had a lot of people diving into depression and anxiety because everything just changed. So now, how can a mother who is going through postpartum depression, without the support that you had, for example, your spouse, your husband, or even the one who has the husband, but the husband doesn't understand anything about it, and even though she's going through it, it's like, come on, you're not the first woman to give birth to kids. Like, your friend over there just gave birth 2 days ago and she's doing fine. How do you think, or what do you think they should do to be able to get back up there?
That's a wonderful question. So first of all, like you mentioned, we're increasingly disconnected, even though we have social media. Right? I may have 5,000 followers on Facebook and not have one friend.
Oh yeah.
So what I would suggest is that, see, because pregnancy is a whole situation by itself, what I suggest to people is to develop deep friendships before them babies come. Because them babies are not just expensive people, they're very needy people with good reason. So if you have your own support system before the babies come, that way, when the babies come, the pressure, when you have people you can resort to and be like, oh, I've had it, I'm having a long day, you have shoulders to cry on, number one. Number two, people wonder as a Christian why I so often tell people to seek therapy. Because for a lot of people, they don't even realize that not sharing in a professional setting with somebody who is empathetic to what they're describing, bottling up stuff is in itself stress on the human mind.
Oh yeah.
You know, so I'm like, get you friends. That's why you've got to invest in relationships.
Good friends.
Quality relationships, you know, girlfriends who y'all can talk about everything under the heavens, right? Number one. And then invest in a therapist, somebody you can connect to and talk to. And number three, yes, when you start seeing that, okay, we've gone a little bit far left on this path, we need professional help. But it is not wise to proceed without any sort of emotional buffer system, at least in this world we live in now. In those days, like you said, those things could be easily masked because there were people everywhere. Everywhere a new mother turned, there was a warm body. You know, there were people who were ready to help. But you and I don't have the luxury of that in this age. Therefore, we have to recreate that setting we had before, just in a different way. Get your friends, get your therapists, and when the chips are down, when the red flags are up, get you professional help.
So I know Anna answered this question, right? But I want to throw this same question to you, at least the second half of it, where it says, do you think having an undesired C-section versus vaginal delivery triggers PPD? Is there a correlation between CS and PPD?
Ooh. Okay.
Yeah, I knew she would like that question.
Okay. See, because Hannah may not understand, but in our culture, it is seen as the normal thing, the proper thing to have babies via vaginal delivery.
Hebrew women.
You get it. There are entire songs, the entire songs about, dear Lord, may I never deliver with the knife being C-section, right? So now imagine a woman who, through whatever reasons, right, this was not a scheduled C-section, something happened, the baby's in distress, and the baby needs to come out like ASAP. You will not believe the things people say to a new mother. That you were not woman enough. Believe it or not, I have heard it. I met a young woman who was in a very bad place emotionally in her community because she had a baby via C-section.
Oh, that's
so you can imagine. I'm telling you, it was terrible.
Yep.
People were like, you were not woman enough. What's wrong with you? Everybody, in quotes, everybody around here has had babies via vaginal delivery. Something must be wrong with you. And she carried that burden for a long while. Totally unnecessary. So yes, I do not see it. I do not think it's directly causal, but there is a very strong correlation between just intense emotional pressure, intense stress, and the likelihood that a woman may suffer from PPD.
Okay, thank you very much.
Thank you.
You're welcome.
So, we have a comment by Jenny. Says, Sam Self made a point by saying that this condition is spiritualized in most African countries. Deliverance prayers are usually made as a way of preferring solutions, and by faith sometimes works.
Oh boy.
Okay, so
are we ready to open that door? That's a question. Are we ready to go there?
Let's keep that door for today. Let's keep that door for today.
Yes, because it may get very intense.
Oh yeah, it's definitely gonna get very intense. You see, I don't always like to look for trouble on social media.
Oh really? Wow. you could have fooled me.
Hey, I'm an innocent man. I'm
yes, indeed.
Yeah, thank you very much. So, doctor, before you came, I was telling Hannah that we need to chat room will collaborate with her and try to get people, and I'm saying people this time around, not just women alone, because even men, I'm sorry, I don't know, but I think men also do go through postpartum depression too.
Absolutely.
You know, and get people, you know, wives, husbands, spouse, or significant other that have been through postpartum depression. Just make it like a dinner night, dinner music, and then talk, you know, we'll talk about experiences, how to help, things to do to help. We learn from each other.
Get some professionals. Yeah.
Yes. Yeah. That could be very helpful. Then doctor will fly into Boston.
Yeah.
We'll come back to Massachusetts for it.
Exactly.
I see myself being roped into stuff right now.
Oh, definitely. You know, I always like to rope you into things.
It's more than enough time. I really do need to come back, guys. So
we have a question. Rachel says, spot on, Dr. Tulu. Everyone in her ears telling her how to care for baby. Do this, do that, and do that. Eat so you can pump. How can we help a mother without causing her more stress?
True.
So I want Anna to take a stab to that, and then Dr. Tolu takes a stab to that.
Yeah.
Then Samsov can give his answer. I don't trust Samsov answer very well, but.
So, I mean, just like she said, everyone can be in the mother's ear saying, do this, do that. And a lot of it can be about, you know, do this for the baby, do that for the baby. People, all of a sudden, it's like the mom becomes invisible through the whole pregnancy. It's asking, how are you? How are you feeling? And then all of a sudden, it's like the mom is invisible to them and it's all about the baby. So I think the best thing that you can do to help, you know, especially when they're just settling in at home, don't expect to be hosted by the mother. Go over and help, do dishes, do laundry, do some of those chores that is taken off of her plate so that she can she can learn to mother her own child.
Yes.
She's not going to be this. Not only has a baby been born, but a mother has been born. So it's important for her to learn, her own way without having people in her ear constantly, because that's, it can be helpful if she asks for the help, but it can be overwhelming and make her doubt herself if people are constantly telling her, do this, do that.
Samson, sorry, Doc, before you answer, Samson, I've seen a situation where a woman just literally gave birth, and then after she gave birth, people came to visit. And when they came to visit, they were like, oh, aren't you going to cook rice for me? Aren't you telling the woman that just gave birth to go and cook rice for them or bring food for them to eat?
Village people. Village people.
It's not village people. In America.
That is a village personality.
You are village people. What did village people do to you, bro?
You have a problem to do.
You, bro. I told you I'm a peace-loving man today. Don't make me.
Yes.
Man, you need deliverance today. You get problem today.
Dr. Solo, please, can you speak on that?
Yeah, I completely agree with what Anna said. And again, because our culture, you all know how we be. Because for many places, once the woman gives birth, either her mother-in-law or her mom literally moves in with them. Okay. Now, everything can be hunky-dory if you had a wonderful relationship with your mother-in-law. Because then she really, truly can be a help to you, right? If she's a more experienced woman, and then it can be absolutely just wonderful. If it's your own mom, again, if she's a reasonable person, you'll have a lovely relationship and she's there to help. Right. But for a lot of people, that is not their situation. So that on top of having to care for new baby, now we got to care for an old baby, an older baby, So what I would suggest people do is have some empathy. I don't know about you, but I've heard, why are you carrying the baby like that? That's your baby. What are you doing? Why are you carrying? The head is not straight. You could have accomplished the same thing by just saying, here, let me show you an easier way to do this.
Right.
Oh, and that thing about doing chores, let the church say amen.
Amen.
Yes.
When my mother-in-law, when she came to help us take care of the baby, she did everything. Mm-hmm. She cooked, she cleaned, she insisted the baby sleep in her room. I'm like, oh yes.
Yeah, oh, that's
yes, please. But I know for a lot of people that's not there. So we need to have these kinds of conversations where grandma, you may need to back up just a few more steps and let her breathe. First of all, she's a new mom. She probably doesn't know the kind of help she needs. You can help her with the things that are obvious. Like my mother-in-law did. She did all the cooking. I do not remember boiling one thing. Help her with the cooking, right? If you're too old to do the laundry, get somebody to do the laundry. But just take stuff off of her so she can rest. Because as we know, a mother who is stressed may not be able to enter lactation properly. And then on top of it, now we're going to pile up this on top of her. Like, why are you not producing milk? What's wrong with you?
Right.
So it's like just piling on so much. No, we need to do better. I realize for a lot of people, because that's how they were raised, they just continue in the pattern.
Right.
But we got to do better. And you know how they say, when you know better, you do better. So we just need to have these kinds of conversations where she's not you, she's her own person. She just had a baby. Be helpful, be gracious, and be quiet.
Wow.
Yes.
Thank you very much.
So well said.
Yep. Well, so do men, someone asked this question, Hannah answered, and I also answered, so I'm sort of two answered. Do men go through postpartum depression?
But of course.
Okay.
I'd like to throw a few stones at you, but I won't.
Please throw the stones.
You are not gonna get me, no, indeed.
Smart woman.
I knew he was gonna take the bait. I just knew it.
Dr. T.
Oh yes, it happens.
There's no need throwing stones today.
It's Sunday. Yes, it's the Lord's Day.
It's Sunday. Nice. No need to throw. At least today. Not like what you did to me last week on the show.
Who, me?
Remember what you did to me last week?
Me? My innocent self.
Oh, okay. But we're definitely gonna come back with postpartum depression on how it also affects men also.
It's so important.
A little light bulb just clicked in my head.
We like light bulbs.
This light bulb is we would want to hear your husband's story on how he was able to help you go through this.
Yeah, I think that's important because he felt helpless, but by telling his story, it can help men that are seeing their spouses or significant others go through it, might help them not feel as helpless as they may.
Yeah. And that day we're going to have both of you here.
All right. See if I can rein him into this. I don't know. No promises.
That would be awesome though, because we seldom hear men's perspective.
Yeah.
When their wives, their beloved is suffering.
Yeah. We'll talk about that in
Yes.
detail. And I like to Doctor knows how I do things.
Mm-hmm.
And Samsung has his style too. So in 1 minute, what advice do you have for ladies out there who are going through postpartum depression, or who are going through things that they don't know, or they've not been officially diagnosed as postpartum depression, but from what we've talked about today, kind of know that it's postpartum depression? What advice do you have for them in 1 minute?
That's a really loaded question, you know. I always tell women that you know yourself the best. No one is going to know you better than you. So if something, even if it's just a really small part of you, is saying something doesn't feel right, something's not right. And it is okay. If there is anything I can say that I want everyone to take away from this, is that it is okay to not be okay.
Mm-hmm.
And it is not okay to stay not okay. It is what I love to really tell people. So you know yourself the best. So if something doesn't seem right, it's probably not. So talk to somebody, whether it is, like Dr. T said, your closest girlfriends, or it's your spouse or your doctor. Talk to somebody and know that it is okay, that you, at least, I know there's different cultures have very different viewpoints, but at least if you come to me, you will not be judged. You will not be stigmatized. You'll be met with love and open arms. And I hope that in your lifetime, you have found that support circle that will meet you the same way. So,
wow.
Yeah.
Wow. That's beautiful. That's beautiful. Okay. Doctor, in 1 minute, what advice do you have for women out there going through postpartum depression?
Just like Anna said, it's okay. There's nothing wrong with you as a person. The same way you don't feel stigmatized when you have a headache and need to go see a doctor. If you have a fever, you know something is not right with your body. Sometimes something is not right with the way your mind is perceiving reality. And it's okay to seek help.
Oh, thank you very, very much. Sam Soft.
Whenever you experience aggression, crying without knowing why, self-hate, don't be silent, and don't keep it to yourself. So speak out and know when to make the decision to get help.
Know when to make the decision to get help. From me, this is what I have to say, right? One thing we all do that affects us negatively is when we assume or we think we are being judged, when we think we are being stigmatized, when we think we cannot say what we have to say because this person will say that about you. The fact is, you are walking on the road of what ifs. What if not? What if not? So I understand all the symptoms. But like I said earlier on, try to fight against the symptoms. Try to do the opposite of what the symptoms is trying to make you do. If the symptoms you're feeling is locking yourself up in the house, not going out, just staying down, stay inside, try to just take a walk. Don't do anything, just take a walk. It's going to be hard because you're fighting against something that your brain is telling you not to do. But push yourself to do it. If the symptom is telling you, oh, just not say anything to anybody because nobody understands what you're going through. Nobody knows. Yes, fact is, nobody understands what you're going through because you are the one going through it. But people do care about you. People care about you, and it's okay not to be okay. And it's okay to open your mouth and say something. Tell the person, I don't need a solution from you. Just hear me talk. Just listen to me talk. And gradually, bit by bit, you would be able to chip your way into getting at least to a particular level of feeling better before you might decide to be like, hey, let me seek professional help. Let me, get a social worker, get a therapist, get a psychiatrist, get a nurse practitioner, get this, get that help. But please, and please don't just stay down. And when it gets to the point where SI comes in, suicidal ideations, please and please call somebody immediately. That's what I have to say. Thank you very, very much, Hannah. Thank you very, very much for coming on the show.
Thank you so much. It's good to have you.
Thank you guys for having me and listening.
Thank you for sharing your story.
It was powerful.
Very powerful.
Thank you.
Very powerful. We can't wait to have you and your. It's going to be a beautiful picture.
Oh yes.
Think about it. Yeah, that's all right.
Yep.
Oh my goodness! I was talking to myself. Of course.
Yeah. It's going to be a beautiful picture.
Yes.
And I'm very sure we, the men, on behalf of the men of the world, will learn a lot from him.
Oh, yes.
Just tell him that the representative of the men of the world.
Yeah.
Because like Doctor said, it's very rare to hear men speak about things.
True, because men don't usually like to talk.
No.
Thank you very, very much, Dr. T.
Thank you.
You are always... I don't know the word. I'll just do like this.
Yep. Thank you.
My pleasure. I'm sorry I couldn't join you earlier. I just literally just came back from a conference.
Yeah.
And I decided to take a short eye, and then a short eye became a long eye.
Well, we are so happy to have you back.
Yeah, we're happy that the long guy ended up and then
you showed up.
Yeah. Thank you very much. Ladies and gentlemen, it's been fun. It's been wonderful. Thank you very much for joining in this week. Next week, we're going to be talking about something very, very funny.
Mm-hmm.
Let me just tell you guys.
We'll talk about it.
I should have said it.
Yeah,
I should have said it. Okay, fine. It's about, let me just give them a little distance.
Mm-hmm.
It's about a man who has been married to his wife.
You will tell them the story. That's it.
No, it's not the whole story now. It's about a man who has been married to his wife.
Give them the title.
No, let's just give them tidbits. Tip of the iceberg.
Mm-hmm.
It's about a man who was married to his wife for 52 years. And then this man came to court and said the 3 children that are his, that the wife said are his, are not his. And the judge ruled. Stay tuned and watch out for the ruling of the judge. We'll see you next week. Same station, same place. Please and please don't forget to follow Hannah on her social media platform.
Yes, please follow
it's
her.
Scrolling right down there. TikTok right there.
Yep.
IG right there. Screenshot it. Follow her and learn from her. She does this thing on Instagram where she educates people. It's very wonderful and awesome. So stay tuned. Next week, we're going to be back. Dr. T, thank you very much. Thank you.
Congratulations.
Sam Soft, obviously, I will not thank you. Well, thank you. Bye. It's your boy Max. I want to introduce a show to you. It's called Chat Room with Max.